When a woman is pregnant, especially immediately she finds out, the first thing she worries about is, hope I have not been doing something that could hurt my baby. Hope I have not been eating the wrong food, wearing the wrong clothes, taking the wrong drugs, or going to even wrong places that could hurt my baby. Today, I shall be sharing foods that pregnant women should avoid to make sure that they are safe and they have a healthy and beautiful baby without defects, and that the pregnancy is not complicated. Yes, I am a pharmacist, but still make sure to consult with your primary healthcare provider. This video is to serve as a guide on things you should avoid during pregnancy. Let's talk about pineapple. Pineapple is a tropical fruit and it has a lot of health benefits. It is a rich source of vitamin C and dietary fiber. It contains an enzyme called bromelain. Bromelain softens the cervix and can also trigger uterine contraction, which can lead to miscarriage or preterm labor. Some people argue that the amount of bromelain enzyme that is in pineapple is not enough to harm a baby, and that you have to eat a whole lot, like very plenty, for it to affect your baby. But I am of the opinion that if it could probably affect your baby, even if it is just a 1% chance to affect your baby, then you should stay away from it. There is no amount of risk you should take knowing that it's going to affect your baby just because you want to satisfy a craving. You can wait after you give birth. You can have all of the pineapple that you want. Now let's talk about caffeine. Researchers noted that caffeine is believed to cause blood vessels in the uterus and placenta to constrict, which could reduce the blood supply to the fetus and inhibit growth. Caffeine can be found in foods like chocolate, tea, coffee, and even Coke. If you can't completely cut out caffeine from your diet, then you are limited to about 200 milligrams a day. That is the amount that is considered safe for pregnant women, and that is like 2 bowls of plain chocolate and 1 mug of coffee, or 2 mugs of tea and a can of cola. I remember always taking a can of Coke every day because I was constantly craving Coke. I do take it one every day or alternate days just to be very sure that I'm on the safe side. Drinking alcohol during pregnancy can increase the risk of miscarriage, premature birth, and even low birth weight. It can also affect your baby after your baby is born by causing your baby to develop a serious lifelong condition called fetal alcohol spectrum disorder, by interfering with your baby's development, causing physical and mental defects. It is important to note that there is no amount of alcohol that is safe during pregnancy. So if you don't want your baby to come out with these defects, or with low birth weight, miscarriage, or you don't want to have a preterm birth, it is better you stay clear from alcohol the minute you find out that you are pregnant. Raw or undercooked meat have parasites in them that could cause serious illness during pregnancy. If you like eating stuffs like barbecue and soya, make sure you are the one making it yourself. Make sure you cook it properly. Some pregnant women even go as far as using a meat thermometer to make sure the meat is properly cooked. This is as far as you can go to be sure that your meats are properly cooked. Let's talk about fish. Some fishes have a high level of mercury. Do not take those kind of fishes. But fishes like catfish, tilapia, they have low levels of mercury. You should stick to those that have low level of mercury, because if you come in contact with high levels of mercury during pregnancy, it can cause real problems for you and your baby. Mercury can damage many parts of your body, including the lungs, kidney, and nervous system. It can also cause hearing and vision problems. So if you are craving fish, look towards catfish and the likes. Although also do not eat fish that is not properly cooked, like smoked fish and some sushi. I know a lot of us crave that, but please do not eat them. And even if you have to make sure you are the one preparing it yourself and make sure it is properly cooked before you take them. Now let's talk about pepper soup. A lot of ingredients are used to make pepper soup, and these ingredients can cause your womb to contract. When I gave birth, I was asked to take lots of pepper soup to help my womb contract and expel the blood out. So it shouldn't be taken during pregnancy, but rather it should be taken during postpartum for postpartum care. Some people will tell you they took pepper soup during pregnancy and it did not cause anything and they were fine, baby was fine. Remember that body system are different. So if they did it and it worked for them, you don't know how your body is going to react to it. So better stay clear of it. Liver and liver products should be avoided during pregnancy because they contain high levels of vitamin A, which can be harmful to an unborn baby. The high levels of vitamin A in liver can potentially cause miscarriage and birth defects, especially during the first couple of months of pregnancy. You should also avoid multivitamins containing vitamin A and liver oil, such as cod liver oil. Now let's talk about sesame seeds. There is a sesame soup in Nigeria. It actually looks like egusi and it looks and tastes very delicious. Sesame seeds can also be found in burgers, in sushi, processed meat, and there is also a sesame oil. Sesame seed can cause the fertilized egg, which is your baby, at the early stage to be expelled by stimulating the uterine muscles. It also raises the body temperature of a pregnant woman and can cause harm to your baby. So you have to stay away from sesame seed, especially in the first 3 to 4 months of your pregnancy. Ripe pawpaw can be beneficial in small quantities because it's rich in nutrients like vitamin A and C, folate and potassium. Ripe pawpaw can also help with constipation, which is common during pregnancy. However, eating too much ripe pawpaw can cause digestive discomfort. Unripe or semi-ripe pawpaw should be avoided during pregnancy because it contains a high concentration of latex and the enzyme papain. Papain can cause uterine contractions, which could lead to miscarriage and preterm labor. Consuming too much ripe pawpaw could disrupt hormonal balance and lead to complications like low birth weight or preterm labor. Some say that you can eat pawpaw towards the end of your pregnancy, and I think that should be from 38 weeks or when you are ready to have your baby. Eating raw or undercooked eggs during pregnancy can cause food poisoning from salmonella, which can lead to serious health consequences. Symptoms of salmonella include high fever, vomiting, diarrhea, stomach pain, and headache. In severe cases, salmonella can cause preterm labor or miscarriage. Pregnant women are more vulnerable to foodborne illness because pregnancy temporarily weakens the immune system. To prevent salmonella, you should only eat eggs that are fully cooked or pasteurized. Egg that is fully cooked is when the yolk and the whites are firm. You should avoid dishes that contain raw or undercooked eggs such as mayonnaise, cake batter, and ice cream. Eggs are a nutritious food choice during pregnancy because they contain protein, choline, vitamins, and minerals. However, you should handle eggs carefully to prevent foodborne illness. Aloe vera contains a chemical that works as a laxative. This chemical can increase the risk of uterine contraction during pregnancy, which can be very dangerous. Aloe vera lowers blood glucose level in diabetic patients. So if you have a history of gestational diabetes, then the side effect can be improper regulation of blood glucose level. It can interfere with the existing method of regulation and can lead to hypoglycemia. Breastfeeding mothers are also advised not to take it because it can be transferred to your baby, which can lead to vomiting and diarrhea in your baby. Lettuce is a good source of folate, which is important for the healthy growth of a baby and for preventing neural tube defects. Folate is also important for early pregnancy. However, unwashed lettuce can pose a risk of food illness for pregnant women. They can harbor bacteria like Salmonella, Listeria, and E. coli. Pregnant women are advised to avoid prepackaged salads because they are at high risk of Listeria toxicity. So if you are going to take lettuce, so make sure you wash it thoroughly before eating, or if you are the type that like fruit salad, make sure they are properly washed before you take them. Some herbal tea may pose a risk to pregnant women. Evidence suggests that some of these herbal tea are linked to miscarriage and to potentially cause uterine contraction. A lot of this herbal tea contains stuff that may be harmful to you or your baby. So it is better you stay away from this herbal tea while you are pregnant. This isn't everything that you should stay away from during pregnancy, but for the sake of this particular video, this is all I could put together for now. If you know that this video was helpful to you, please subscribe, like, and comment on my video. It is always best to consult with your healthcare provider before making any dietary changes during your pregnancy. They can actually provide personalized advice based on your specific health condition, and that will ensure that you and your baby are safe. So if you are pregnant, I wish you a successful pregnancy journey, and thank you for watching. I'll see you in my next video. Bye.